What is the gold standard test for gout crystals? Imagine trying to catch a tiny, needle-shaped crystal that causes painful flare-ups in your joints. The most reliable way to do this is through a process called joint aspiration. This involves inserting a small needle into the affected joint to draw out a sample of the synovial fluid that lubricates your joints. Once the fluid is collected, it is examined under a polarized light microscope. If monosodium urate crystals are present, they appear as needle-shaped structures that are negatively birefringent, meaning they change color when viewed from different angles under polarized light. This direct detection confirms gout with high certainty and is considered the gold standard for diagnosis. While this method is very accurate, it is not always easy to perform. It can be invasive and sometimes uncomfortable for the patient. Because of this, doctors often use other supportive methods when joint aspiration isn't possible or practical. Blood tests measuring uric acid levels can suggest gout but are not definitive because some people with high uric acid never develop symptoms, and some with gout may have normal levels during an attack. Imaging techniques like ultrasound and dual-energy computed tomography are also helpful. Ultrasound can reveal urate crystal deposits and signs of inflammation, while dual-energy computed tomography can directly visualize urate crystals in joints and soft tissues without needing a needle sample. Understanding gout symptoms and diagnosis is key. Gout often strikes suddenly, causing intense pain, swelling, redness, and warmth in the affected joint, most commonly the big toe. Blood tests for uric acid can support diagnosis but are not conclusive on their own. Imaging methods can help identify urate deposits when joint aspiration isn't feasible. It's important to remember that each person's experience with gout can vary, and diagnosis should always involve a healthcare professional. They will consider your symptoms, medical history, and test results to determine the best approach. Always seek medical advice for proper diagnosis and treatment options, as managing gout effectively depends on accurate identification of the crystals causing the problem.